Before a discussion on chronic pain conditions, I want to just briefly talk about a few principles about just psychology of pain. So as we mentioned previously, pain is both physiological and psychological, right? And so as such, the interpretation of pain is going to be very heavily influenced by the individual and their background, right? As well as what else is going on in their lives. So you can see a list here of different things that have an effect on pain perception. So everything from personal factors going on in their life, stressors with that are going to affect and make pain seem worse. Medical factors with regard to chronic pain syndromes that we'll be talking about with the rest of this unit. And then, everything from social, cultural, and sport context as far as what their expectation growing up with pain was. So again, just a couple of definitions that we saw before: pain threshold and pain tolerance, right? We're really going to be looking at pain tolerance here, right? And so this pain tolerance is going to come from the interaction of pain within the limbic system. And so the limbic system is a network of areas of the brain that's responsible for emotions. And so that negative emotion associated with pain comes from the interaction with that limbic system. And so the limbic system gets its input from the thalamus as the pain makes its way up. It's also going to interact with those areas on its way to the somatosensory cortex, and then we will get the negative feelings associated with pain. And those are going to be very individualized, and the amount of pain that somebody can tolerate will be based off of that perception of the negative emotion component of pain. As an example of that, we see that stress within the body, just the idea of the emotional component of stress and or pain will have varying effects on different areas of the body and present the following signs and symptoms listed here. Because pain is such an emotional and subjective component, we need ways to evaluate and identify the level of pain and whether or not we're making progress with that. And so that's where these pain inventory surveys come. You can use everything as simple as a 0 to 10 pain score. You can use a visual analog scale, which is a 10 centimeter line. You can do all sorts of different components with that. But these surveys here in particular, with the sports inventory for pain being more sport specific, try to identify situations in which people may or may not be experiencing pain and to what level that pain is interfering with their daily life, right? And so looking at it from going beyond just the level of pain to the interference with their activities, participation, and social roles moves pain diagnosis and treatment into the area more comprehensive and more individualized to that patient. And so by using these inventories and surveys, we can really get a much better grasp on the emotional component of pain. So before discussing chronic pain and chronic pain syndromes, I really want to again take a second and make sure we're using specific terms appropriately, right? Because chronic in this nature doesn't necessarily mean just a long time, right? Chronic pain, by definition, does last a long time, but it's going to be pain that persists beyond the normal time that's expected for healing. So the idea here is in chronic pain, we have an abnormal length of time for pain to occur. Right? It's normal to expect pain to last a certain period of time and then decrease. Right? In chronic pain, that doesn't occur. That is different than from persistent pain, whereas persistent pain can be chronic in nature, meaning that it lasts a long time, how we traditionally use the word chronic, but it's a symptom of a treatable condition. So we often might have people that are in persistent pain because the tissue or injury has not completely healed yet due to inadequate rest or recovery, right? So for example, the idea of somebody dealing with tendinitis, right, or some sort of tendon problem, and they continue to participate in their sport for 2 to 3 months, and that tendon doesn't have time to heal. It makes sense that they would have pain lasting in that 2, 3, even more months, because the tendon has not been able to recover due to the continued participation in physical activity. So I like to think of persistent pain more as repeat acute pain, right? So the persistent pain is based off of the fact that they continuously re-injure, if probably not to the same extent as the initial injury, but each time they participate, they go through that inflammatory cycle again, which causes pain, compared to a chronic pain, right, which is now beyond time for healing, not associated with tissue healing, and lasts, minimum 3 to 6 months. So in the discussion on pain and the physiology of pain, we talked about the role of pain throughout the rehabilitation process. And so I want to hit that again here from more of the psychological perspective, from the standpoint that chronic pain, right, is going to be injury style pain, but not associated with injury, right? So you're not going to have a chronic pain syndrome with benign types of pain, right? It's going to present more as injury pain. So any discussion on chronic pain syndromes would be lacking if we did not specifically take a moment to realize that people suffering from chronic pain are really suffering in a much more holistic way than individuals with just acute pain, primarily from the standpoint that pain is so all-encompassing and takes such a dramatic toll throughout the entire individual's life. And so we do know from studies that athletes and individuals suffering from chronic pain are at increased risk for suicide, right? We have studies suggesting that. And so we need to be aware of that, psychological impact on their overall mental health of chronic pain. And remember, the chronic pain is that negative emotional response. So they have a constant negative emotional presence that they have to deal with that can lead to much larger psychological impacts. At that same note, we also know that they are at risk for developing chemical dependencies on their medications that they are taking. The opioid epidemic often starts with individuals that have chronic pain and then get addicted to the opioids or whatever pharmacological intervention that they are using to manage their pain, and end up creating that chemical dependency of that. So individuals that have chronic pain need to be identified for if it's important for them to be referred to a mental health professional for advanced care and treatment. So there are obviously non-pharmacological ways of managing pain that a mental health professional or even an athletic trainer can help with, right? And there are physical methods associated with that, but as far as the massage and TENS units that we talked about before, but there are also psychological and psychosocial strategies with there, ranging from auditory distraction, maybe during acute pain situations. So if somebody is working on range of motion, right, and they're working on pushing through that last little bits of range of motion, just talking with the athlete, getting them focused on just listening and communicating with you can distract them from some of the pain and decrease the emotional or the negative emotional stimulus that they're getting, or everything just down to listening to music with that. All right, but there are psychosocial strategies as well, disassociation and association strategies. You can see those listed there. Getting really into this is not really the purpose of here, but just understand that there are these strategies, right, as far as trying to take the individual out of the painful situation by either distracting them, focusing on specific things besides the pain, mental imagery and relaxation with deep breathing, different things like that, or trying to associate the pain now with more positive associations. The idea, especially with athletes, that pushing through the pain, right, or pain means you're working, is often something that they have a history with. So if we can get them thinking about the association of their pain, right, with progress and the rehabilitation process, then it's not as negative there. So to sum up, right, we've talked about this, and we need to continue to remember that pain is both sensory and emotional, right? And when we're looking at chronic pain syndromes here in the next few lessons, we're going to be needing to address specifically a lot of that emotional component, right? Perception and sensation are not the same, right? Pain has to be sensed and perceived. At that same note, right, pain does not need to be caused by an injury. And we'll see this in a lot of the chronic pain syndromes, that we have pain in the absence of injury. And so there are some ways to affect long-term painful perceptions using a variety of different strategies. But a lot of those are going to be requiring the referral to mental health professionals. So that's the introduction things. Next, we will focus on some of these chronic pain syndromes.